Good afternoon, everyone. So for the next 15 minutes, what I'd like to do is ask us to consider three things. First, what was the theory of poverty that sat underneath the war of poverty itself? That is, how did they think about who was poor, why they were poor, and what we ought to do about it? Second, how has our thinking about these issues changed after 50 years of research and on-the-ground interventions? And third, what are the implications of that for how we move forward, with some particular attention to how AmeriCorps VISTA, VISTAs themselves, and the agencies they support might begin to think about a new anti-poverty agenda for the next years and decades. So the war on poverty era, it seems to me, poverty was typically understood to be a thing that happens to other people. President Johnson suggested that poor people were in a world apart, isolated from the mainstream of American life and alienated from its values. People living in poverty were them, not us. Is that something I'm doing? And poverty itself was an anomaly, an aberration. Let me try that again. People living in poverty were them, not us. And poverty itself was understood to be an anomaly, an aberration, a deviation from the norm. So part of the mission of the Great Society was to incorporate them into mainstream institutions and culture, through education, through job training, through medical care, through housing, and so on. But we now know that poverty in the United States is not an anomaly, nor is it something that's experienced by a small minority of people. This is the official poverty data. This is probably pretty familiar to most of the people in the room. It shows a poverty rate of 14.5% for 2013. That's about 45 million people. If we look at the Census Bureau's newer and better supplemental poverty measure, we see that income poverty in 2013 was probably closer to 15.5%, or about 49 million people. Either way, these measures are only telling us how many people ended up with net income below the poverty line by the end of the year. But we now know that people move in and out of poverty over the course of a year. People may be poor one month and not poor the next. So if we step back and we ask, how many people experience a spell of poverty over a 4-year period, we see that 35% of all Americans, more than a third, are poor at least once for 2 months or more. That's lesson one. Since VISTA's founding, we've learned that poverty is widespread. It's a much more common experience than we thought it was then. It's not something that happens to them, it's something that happens to lots of us. Now that's important, I think, in part, because if people cannot be mobilized to fight poverty for altruistic reasons, perhaps they can be mobilized for selfish ones. It's also, I think, a way to highlight one of the virtues of VISTA's key program features. Because VISTAs earn a poverty-level stipend, perhaps it's easier to think of people struggling to get by with limited resources as us, not them. Poverty is also, by the way, a different kind of problem than historically we've thought it is. While 35% of us experienced poverty over that 4-year period, fewer than 3% of us were poor for the entirety of that 4-year period. Long-term persistent poverty is real and we must address it, but that's not what most poverty looks like. In some ways, I think we've been focusing on the wrong problem. Points us to lesson two. Given how many people are perched on the edge of poverty and how many people slip in and out of it, perhaps instead of talking about poverty, we should be talking about insecurity as the problem of this age. More and more Americans live precarious economic lives and are utterly unprepared for an emergency that suddenly increases their expenses or reduces their income. What can we do about that, we should ask? And how would remedies directed at insecurity differ from those more traditional remedies directed at poverty? Lesson three is that childhood is profoundly important, even more than we thought it was in the 1960s. And the stakes are especially critical for very young children. Stress, we know, has physiological consequences, and poverty is exceedingly stressful, especially for children. Combine that with inadequate prenatal care and childhood nutrition, and you wind up with irreversible cognitive, social, emotional, and health deficits. Being in poverty as a child is associated with lower achievement later in school, reduced earnings in adulthood, higher rates of unintended pregnancy, higher rates of incarceration, and higher rates of things like cardiovascular disease, mental illness, and disability. So, if you want to reduce the number of adults who are going to be poor tomorrow, reduce the number of children who are poor today. And remember that the largest group of people living in poverty are children. Lesson 4. The Kennedy administration, as we just heard, started paying attention to poverty in part because of Bobby's visits to poor African American communities, to Appalachia, and to Native American reservations. Now, poverty was not and is not a problem only of those particular people and places, but there's still, I think, a really important lesson here. Where you are born has a lot to do with the kinds of opportunities that you're going to have available to you or the kinds of opportunities that you are not going to have available to you. And among other things, I think this reaffirms the importance of place-based policies and community-specific initiatives. And that's one of the most striking patterns of the modern period, the rise of poverty in the suburbs. And this has particularly profound implications, I think, because so much of our social service infrastructure was built to deal with poverty in the cities. It's another way, by the way, in which poverty may be a different kind of problem than we thought it was then, and perhaps offers another lesson that might be especially useful for VISTA. Lesson 5 is that race is as important today, alas, as it was in the 1960s. We have clearly made significant progress in reducing African American poverty from its radically high mid-20th century levels. But it's still 3 times the rate that it is for white Americans. And African Americans still fare worse across pretty much any dimension that you would like to pay attention to, whether we're talking about income, wages, wealth, mobility, education, access to health care, life expectancy, or infant mortality. I noted earlier, you'll remember that 35% of Americans experience poverty over that 4-year period. It's 49% for African Americans, 53% for Hispanic Americans. We've got to better reckon with the ways in which disadvantages accumulate, and with the fact that our unique historical legacies mean that poverty for different groups might have different roots and therefore require different remedies. Lesson 6. I've noted the continued importance of paying attention to children in poverty. But children can also exacerbate the poverty of adults because they are inevitably dependent and their care costs time and money. This is a much more acute problem than it was 50 years ago, simply because there are so many more women in the labor market. And because we still live in a world in which women do the overwhelming majority of all unpaid care work, it's their earnings that suffer most. It's part of why female-headed families have much higher poverty rates than two-parent families, something the Johnson administration knew even then. But this has only gotten worse, and this not need be the case. We know this because, as you can see here if you look at the blue lines, there are many nations with higher rates of out-of-wedlock births than we have here in the United States. Every single one of those nations with more lone parents has lower rates of child poverty than we do. Those two things do not necessarily need to travel together. More specifically, if you're working at the community or agency level with poor women with children who may also be caring for sick or aging family members, remember, you've got to foreground the problem of who cares for those who need care. What we've also learned is that it's not just that some people cannot work because they cannot solve the caregiving puzzle. Other people cannot work because, for a variety of reasons, illness, injury, mental illness, physical or developmental disability, they're not well suited to the modern labor market. This results in much higher poverty rates for them. We saw earlier that few poor people are consistently poor over that 4-year period, maybe 3% of the population. Well, 2/3 of that group has one or more disability. Lesson 7 is that disability must be foregrounded in our thinking much more than it has been. But even those who are able to work and do may still wind up being poor nonetheless. 32% of all women who work and 24% of all men who work in jobs paying wages so low that even if they work full-time all year round, they will still be poor. It's something we've been seeing for decades now in soup kitchens and food pantries across the country. The rising numbers of working people who cannot earn enough money to put food on the table, even with full-time jobs. It's a problem that's particularly acute among communities of color. 42% of African Americans and 42% of Hispanic Americans and 36% of African Americans work in poverty wage jobs. So no matter how many hours they work and no matter how many weeks they work, they cannot escape poverty with wages alone. Which means either labor markets need to change or the public and civic sector programs serving them must. Medicare and Medicaid point us to lesson 9, showing us that access to health care reduces poverty. The Affordable Care Act, and especially its expansion of Medicaid in those states that have chosen to take part, is already giving us additional evidence of this. We could reduce poverty even more, by the way, if we add in dental care and mental health coverage, two problems that are particularly acute among low-income communities. On the micro level, you can help people in your local communities get coverage, access care, and deal with small medical issues before they become big ones. If people are less sick, they will be less poor. And of course, if people are less poor, they are less likely to get sick and remain sick for long periods of time. Lesson 10. Mass incarceration in the United States of America is a post-war on poverty phenomenon. The effects are disproportionately concentrated in low-income communities and among African American men in particular. And anti-poverty programs have to think about the prison and the universe of people affected by it if they're serious about improving well-being. Whatever else it is, our criminal justice system is a massive engine for making people sick, angry, and poor. Lesson 11, we got to start thinking about climate change as a poverty problem. Hurricane Katrina is the canary in the coal mine here. What are we doing now to help poor places and the people in them prepare for this very new 21st century poverty problem? We've got to start doing it because it's low-income communities that are going to get hit first and affected the most. It's not all bad news. No, that sounds awfully grim. For example, thanks to Social Security, we now know that we can reduce poverty a lot and rather quickly. Right? Here we've done it by sending money regularly to older Americans. The Earned Income Tax Credit and SNAP teach us the same lesson. Cash and near-cash benefits have significant anti-poverty effects. More local programs, I would argue, can learn this lesson. And trust the growing body of research that shows that unconditional cash grants to poor families may be the single most effective anti-poverty intervention we have available to us today. Now that requires, among other things, trusting poor people to know what's best for themselves. That seems to be a lesson, however, that's entirely consonant with VISTA's mission of self-determination and low-income communities having a voice in their own service delivery. And finally, can we dispense with the notion that the war on poverty failed? It did a lot, even if it could have done more. There were real successes to the war on poverty. How do we know this? Well, here's one way. Let's take a look. If you look at that green line up there, that shows us what's called the pre-transfer poverty rate. That's how much poverty has been created by the economy without counting the effects of anti-poverty programs. Notice that the economy itself is producing about the same amount of poverty as it was 50 years ago. That black line shows us, using the supplemental measure, how much actual income poverty remains after we take into account public policies and programs. Over the war on poverty period, we brought poverty down from 26% to 16%. Now, I'd argue that's not nearly good enough, but it's not nothing either. So those aren't the only lessons that we might take away from the last 50 years, obviously. But I think they offer one place that we can start to begin thinking about what we should be doing now to fight today's poverty and insecurity. Right? Remember, not all past solutions will be the best ones moving forward. It's not the same world it was then. And we can't build 21st century anti-poverty programs on 20th century notions of the roots of need. Thank you all. Thank you, AmeriCorps VISTA. Enjoy the rest of your day and the next 50 years of service.